Amanda. So now that I've completed all of your assessments, I've developed a care plan that I think will help to create a healthy oral environment. Would it be okay if I discuss this care plan with you?
Yeah, for sure.
Okay, great. So upon completing your periodontal risk assessment, I've determined that you have generalized moderate biofilm-induced gingivitis, which is modified by saliva-reducing factors and pharmacological factors. Gingivitis is a reversible bacterial infection that is confined to the gingival tissue, and as I said, it is reversible through proper oral hygiene care. The goal that I hope to achieve in treating this gingivitis would be to create an oral environment that promotes gingival health by the end of care. What goals do you hope to achieve by treating your gingivitis?
I would like to stop my gums from bleeding and improve my oral hygiene care to have the ability to have healthy teeth and gums.
That sounds like a great goal. So the first intervention that I'm going to be educating you upon is I'm going to be giving you a cleaning, which will help to remove any of that plaque and calculus deposits from the surface of the teeth. With getting a cleaning though, there are a few risks and benefits. The risks being you can experience some sensitivity, and that could be a cause of the calculus biofilm accumulation on the teeth, which could be covering some of the root surfaces on the teeth. And when I go in and give you a cleaning and I remove that calculus deposit, that would expose the root surface, which could cause some sensitivity. Another risk would be that you could experience some bleeding and sore tissues during the cleaning, which can definitely be managed by a pain management intervention. As well as normally the benefits of getting a cleaning do outweigh the risks, such that your teeth will be biofilm and calculus free, which would also make it a lot easier for you to be able to clean your teeth with brushing and flossing. I will also be giving you some education on the gingivitis disease process and how it develops, and to evaluate this, I will be asking you to reiterate your risks for developing gingivitis, as well as asking you to explain back how gingivitis develops.
Yeah, that sounds great.
Okay, so I do also want to introduce you to a new toothbrushing method, which would be called the modified Stillman toothbrushing method. With the modified Stillman toothbrushing method, it can help to stimulate the gingival tissue, while also it can help to prevent any further accession of the gingival tissue, which I have noticed on your mandibular canine teeth. And I will just have you evaluate this just by having you demonstrate this technique on a model, okay? I also have noticed that you are flossing 2 times a day, which is really great, but I do also want to introduce you to a cool aid that I think will really help to reduce some of the gingival inflammation that you are experiencing in your gums, and that would be interdental brushes. Interdental brushes are proven to reduce gingival inflammation, and after you using them for about 1 to 2 weeks, I will reprobe to measure the gingival inflammation, and hopefully we'll see a reduction by about 1 to 2 millimeters.
That would be great. I do find flossing a little bit difficult, but I do know that it is beneficial for my teeth and gums.
That's great. Do you have any questions regarding the interventions that I've planned to help treat your active gingivitis?
Not at the moment.
Okay, great. So the next diagnosis that I've come up with is that you are at risk for developing caries through saliva-reducing factors as well as through your dietary habits. Do you know what caries are?
I think it means cavities, but I brush my teeth 5 times a day and floss twice a day.
That is right, Amanda. Caries are cavities, and that is a great point that you did bring up, but caries can also be developed through having a dry mouth, which the term for this would be xerostomia, and it can also be caused by the dietary habits that we do have. The goal that I've developed to help you reduce your risk for developing caries would be to reduce the risk of caries through increasing the frequency of your recare visits, as well as through providing you with a fluoridated treatment to help strengthen the tooth surface. What goals would you hope to achieve in regards to this diagnosis?
I want to decrease my risk of developing cavities through changing my oral hygiene habits.
That sounds like a great goal that I definitely do think that we can achieve. So the first thing that I want to do is I want to help you to reduce the risk of you developing caries through educating you upon how they develop. I also think that a topical fluoride application would be beneficial in strengthening the tooth surface. With fluoride, though, there are a few risks that are associated with a fluoride treatment, such that when it is ingested, it can cause acute fluoride toxicity, as well as when there's an excess amount of fluoride on the tooth surface, it can cause something called fluorosis. With fluoride, there are often more benefits than risks, though, such that it can remineralize any demineralized areas within the tooth surface. It can help to prevent caries from forming, and it can also help to prevent any sensitivity on the tooth surface. I've also included a nutritional counseling session in your care plan, which is where I'll be introducing you to some healthy snack alternatives from the Canada's Food Guide, and that will help to hopefully reduce your risk of developing caries.
Okay.
So I also understand that you are experiencing some dry mouth lately, and so in your care plan I've also included xylitol mints, which will help to reduce your risk of developing caries through increasing the salivary production in the oral cavity. Finally, I've included a selective polish in your care plan, which I'll be using a fluoridated toothpaste rather than a polishing agent to remove the extrinsic stain from the surface of the teeth. And there are risks with polishing with a polishing agent, such that it can remove a microscopic layer of the enamel, but with using a fluoridated toothpaste, it will only remove the extrinsic stain from the teeth. After listening to the interventions that I've provided with you, do you have any questions regarding your diagnosis of caries?
No, I think that all of the interventions and treatments that you have developed will be very beneficial.
Okay, great. So for your final diagnosis, I have diagnosed you with periodontitis, and you are at a moderate risk for developing this. This diagnosis is modified by your pharmacological factors or the medications that you're taking. So that can definitely increase your risk of developing periodontitis. I hope to reduce your risk of developing periodontitis through giving you some education on how it develops and on the disease process. Now that I've presented you with the diagnosis and the interventions, how confident do you feel that we can achieve the goals that we have set out?
I feel fairly confident that I will be able to reach my goals by the end of the treatment, as I really do want to have healthy teeth and gums.
That's awesome, Amanda. In regards to your appointment plan, during your first appointment, I will be giving you a cleaning on the top right teeth, as well as the front teeth, and I'll be educating you on the modified stone toothbrushing method and discussing caries. I will also be introducing the use of interdental brushes. At the second appointment, I will be cleaning your top left teeth, as well as the bottom left teeth and the bottom front teeth. I will be evaluating the brushing methods and following up on the use of interdental brushes. I will also be reviewing the caries development process and teaching you about gingivitis. During your third appointment, I will be cleaning your bottom right teeth and reviewing gingivitis and completing the nutritional counseling session. During your fourth appointment, I will complete the selective polish and giving you a fluoridated treatment, and I will also introduce you to the xylitol mints. At the fifth appointment, it will be a reevaluation appointment where I will review your brushing methods and review caries and gingivitis. Do you feel that this is a sufficient plan that we can work through each week?
I do.
Okay, great. So now that I've discussed and presented with you your care plan, and I've talked to you about what will be happening at each appointment, and I've explained the risks and benefits of the interventions that I'm going to be providing you with, do you give consent to go ahead with the treatment that I've planned for you?
Yes, I do. Thank you so much.
Okay, great. Can you just sign right here? Thank you.